we analyze the information. The first attack of the patient is the journalist come from China. The Thai people, that is the first patient in Thailand, begin about 15 January. It takes about 5 months until now. And the result of the mortality and morbidity of the COVID-19 in Thailand, we know that about 95% of the dead patients are above 60-year-old. Then most of them, 90% have the underlying disease such as cancer or chronic renal failure. Has managed by the policy of the system. Thailand increased the patient. About 1 or 2 weeks ago, we have the infected patient less than 10 number. And now we just about the patient hospital about 14 and 15 patients. That it means that about the patient total number 3 people complete clear and they had the discharge from the hospital about 2,900 of the patient. Around the Thailand, you know that in Malaysia, Indonesia, Philippines, and even Singapore.
ผมเขียนบอกให้อ้อบอกว่าให้นี่ขอเดี๋ยวไปคุยกัน
You must stop your microphone anyway. We know that around Thailand, many countries have the second wave of the COVID-19. Even in America, in Europe, or in Brazil, Latin America. That means that all around the country around Thailand, except Vietnam, Laos, they have the number of the management of the COVID-19 that is very appropriate. So this is the full data until now since January that we had first attack. I want to analyze that about the short and long-term effect. It means that we have number one, Thailand. We have the professional code. We have the what we call primary care cluster in the community. Thailand, we have the revolution of the public health about 20 years ago, and we set up the priority of the public health system, the primary and secondary and the tertiary. And the tertiary group now we have the district hospital, and that you know, we have the famous volunteer of the public health about 1 million, more than 1 million around the country that work very effective and very active about COVID-19 in the community. That is make Thailand is the most country that we have the result of the stop the try to prevention and not to try to manage the COVID-19. The second, the process in the community that I concerned with, I have the active about 20 years ago. I work with the civil society in the community about the health system. In the health system, especially the public care cluster, we set up the public policy for the people that we have the health institute for manage them, that we try to make the public policy for the people managed by themselves, such as they take care about themselves, self-quarantine, home quarantine, or even the process of social distancing in the community. In the protocol in the community of the district. This is work with the bureaucratic system. We call the district health officer or the district health board that we manage them together in the every district in the Ubon, Ratchathani, Sisaket, Yasothon, in this area of the country, and in every area of Thailand. So this make the system of the public health make them very effective for combat and manage for the COVID-19 about five months ago. But now we confront with about long-term impact. That is the economy. About the data of the Thailand, we know that until now, about 70% the income of the people, total people decreased, and then 60% of the income cannot come from anywhere because they lose their job, they be unemployed. So this is the very important and the most seriously. In Thailand, we has been the data, the number of the people that be unemployed about 7 to 8 million people. Most of them is the lower class, about 40%. It means that during the COVID time, now we have the problem of about 30 million people that's disturbed by the economic problem, by they cannot work by themselves. So the most important in the long-term period, we must thinking about the balance of the health right and the health of the freedom of the from hunger and in the economic. So this is the most dangerous and most important topic that we must concern about the economic status of the population, especially the lower class, especially about 30 million people in Thailand. And I believe that that is the most important economic status all over the world that problem confront with about the economic and income of the people. That we see that in many countries there has many crises, they have many chaos, even in the big country such as USA or other area in the world before. So I think that this is the short and long-term impact and how we manage this crisis. I have enough time to show how we manage this crisis. Kun Nanoot, can I show some information about the how management in this situation? I think that we must take the crisis to the opportunity to manage the COVID-19. Number one, I believe in what we call people participation for the public policy. I work with the people in the community in the health system about 20 years ago. What we call the health status in the district. And this, when we have the COVID-19, that disturb the people in the community in any life, being life. So we try to set up the health rule to manage by themselves and manage by the social distancing, physical distancing in every activity in the community. And they work with the district health board. They work with the district chief officer and many other in the local area. That it means that we believe that the people, they can take care of themselves and manage themselves. This is the process that we, depending on the people participatory about the public policy for manage for the COVID-19. And in every district in Ubon, Ratchathani, or even in the area 10 of the health area, we can set up this rule for the people in the community. The second is what we call how to manage in the situation now. We have the water above the dam. That is, people come from abroad, from Malay, from Indo, from Singapore, because the people from Isan try to move to get a job in everywhere in the world, even in America or Europe, or go abroad to the graduation. So this is just like the water above the dam. So how to manage them and how to make the state and local quarantine for these people. I think that this must continue to the local area and make them analyze and they understand that save them, save their family and save their people and save their parents, that we can get the participate from the everybody that come from the abroad. The second we approach is in our country we have the patient that is asymptomatic and what we call pre-symptomatic COVID-19. That is about 60 to 70% of the people that get about the COVID-19. So we use the laboratory investigation, one province, one lab. In our medical college, we have the hospital. We try to set up lab for the RT-PCR to active case finding in the community and how to find them in the people that take risk for the COVID-19 and in the area that predisposed to the COVID-19. The third, that the last, I want to announce to you is what we call the ethnic review in the UNESCO International Bioethics Committee, that inequality and the poorest and even the people in the world or even in Thailand that's unemployed, there is the migrant worker or even the OS, they're very predisposed for the COVID-19 and disturbed by the economic long-term impact. So I had to set up the protocol for the manage about the economic and how we use the ethnic review in the economic and social and the politics now for manage for the COVID-19. Number one, we must use an interdisciplinary dialogue class. So in the Ubon Ratchathani, we try to make a dialogue for the many academic part in the university, in the faculty, and even in the community to how to solve this problem, how to solve the unemployed, how to solve the inequality, how to make them has the prolong the income to serve by themselves and their family. The second, we try to think that health is a right of each human being. So even in its important, we must distribute this duty into the community. And the third is the vulnerable individual. We have the poorly disability. We have the ethnicity. We have the people in the prisoner or migrant worker or even refugee. All of them is the vulnerable individual that is we must take care of them very much. And the last, we must to set up the political view and public policy that how we go and went to the new normal. New normal, in my opinion, is we try to set up the policy that is the sustainable development in 17 the proposal by the WHO. So the new normal, we must make the policy that concern about the SDG and make the people analyze and make the state or the government to get them and for the policy to manage in the post-COVID, because we realize that COVID-19 is still with the people in the world or in Thailand about 1 or 2 years until we have the vaccination. All of this is about the short and long-term impact and how to change about the crisis into opportunity for the population, for the world, for Thailand to decrease the violence and make the future in the new normal situation. Thank you, Kap.
Right. Thank you very much, Dr. Niran, for providing us the big picture of the impact from COVID-19. It's not just public health issues, but also have an impact on economy, which is going to be a long-term impact, causing unemployment and everything. And he mentioned that we should make balance between health and economy. He proposed that the way to solve this problem, we should get people involved in policy process. He mentioned the word participatory public policy. Once people have engaged in the policy process, they can create their own measures that suit to their society and analyze the problem of themselves so that they can help solving this problem together with the government. But definitely, the government should have a political will to get people involved as well. He also mentioned further to sustainable development and to take this crisis as an opportunity for sustainable development. Thank you very much. May I introduce the next speaker, Mrs. Taslima Akter. I will call her Keya in short. She is a project coordinator for the Center for Disability in Development, CDD, from Bangladesh. CDD has driven an issue of inclusive society for people with disabilities. I am sure that the COVID-19 has shaken the inclusive society. Let's hear from her. Keya, the floor is yours.
In today's discussion. Sorry, can you hear me? Okay.
Yes.
So first, I would like to give thanks National Health Commission for organizing such type of excellent learning and sharing event and to give me opportunity to share my experience, the role of the civil society in response to COVID-19. So we all are aware about the impact of COVID-19 in worldwide, and similarly in Bangladesh also is largely affected in Bangladesh, impacted by the COVID-19. And according to yesterday report, around 47,000 people are infected, and the death is 650. So that is a very old situation, and it is every day the number of infected is increasing. So you already mentioned the CDD in my organization in development. We are working for the inclusive society in Bangladesh. So mainly we are working for our target group is the person with disabilities, and in CDD I am also coordinating a program, and we in my project we are implementing in 11 districts of Bangladesh. So where around 2,000 persons with disabilities involved in my project. So recently we have regular communication with the beneficiaries of our person with disabilities, and we have also recently conducted an in-depth interview with some person, more than 30 persons with disabilities from different age, different types, and different sex. And we have also some communicate with other stakeholders in the community from like self-help groups and local government. And from the discussion, we found there is the problems person with disabilities mainly face in the community. Mainly the person with disabilities, there are many problems the person with disabilities faced. So there is a problem, the person with disabilities are the greater risks of contracting the virus. And there is a certain group of person with disabilities, you know, there is a visual impaired, there is a speech and hearing, there is a intellectual disability. So the information awareness message is not accessible for them. So they are not accessing because this is not thinking in inclusive way. So this is also the problem for the person with disabilities to get access in the awareness message also. And we all know the person with disabilities always depends others. So it is also a challenge for them to keep the social distancing also. And there are also another big challenge. Many persons with disabilities require the rehabilitation service, like therapy and other services. So due to social distancing and the lockdown, this rehabilitation service also stopped. So this is also uh, is a challenge for the person with disabilities, also deteriorate their health condition also. And already we all know, and previous discussion also shared about the economic conditions. So same problem in Bangladesh, and in the case of the person with disabilities is really badly impacted, because most of the person with disabilities living in the rural areas, so they are involved in the daily income. So this is also stopped. So their income, not only person, their family income also is stopped. So this is also created a big problem. So they are struggling, and they are already reduced their food intake also. So this is also is impacted in their immunity system also, because they are reduced. They are normally they intake 3 times in a day, but now they are reduced, and sometimes they are 2 times intake the food. So this is also impacted in their immunity system, which is very crucial to fight with the COVID-19 also. This is the problem. And some cases we also observe, and we also hear listening from the person with disabilities and from the others. So person with disabilities and the family members, sometimes they need some medicine, like for other non-communicable diseases. Some have some mental health problems, some have the like epilepsy, some have the diabetic patient and have taking the regular medicines. So this is also stopped for to intake, and for the economic condition, they not able to buy this medicine, because they are struggling their regular food. So this is also deteriorated their health condition. And another big challenge we also observe, the all those situations, person with disabilities are extremely worried about to cope with this situation, and that with their income source, and also this crisis, and also their future. So this also increase their anxiety and stress, and sometimes they are panic with this issue. So this is, we also observe the problem among the person with disabilities. And another challenge this is also a big challenge, because the government services, government have also provided different services, but it is not, this is for the services for all, like relief. So it is also difficult to reach these government services, because this service is not planned for the person with disabilities, for all. So sometimes challenge to reach the distribution point, especially the severe disability, and also to compete with the others. So this is also another big challenge. And in the community and rural area, there is also some organizations, some agencies, some institute, they are working their support for the poor people, but they are also not adequately address the person with disabilities. So this is also another big challenge. So this is the general challenge that face person with disabilities. And I also like to mention especially the children and women with disabilities, the problem they faced. The children with disabilities, definitely this is the very difficult, confined at home, and some children with disabilities, especially entity who are having the development problems. So they are not used to confine at home. So sometimes they are some students with disabilities also are going to school. So through this school and outside they learn social interaction. So this is also stopped. So this also for this situation, so sometimes it also increase their hyperactive, sometimes they are offensive, they hit their parents also. And sometimes some intellectual disability and others, autism, they go out, and it also risks to infected by the COVID because they go out. It's not parents can't control them in home, so they go out. It also risks to affected by the COVID-19. So mainly challenge. We also, and definitely the domestic violence also increased in the worldwide, we know. So it also impacted in the women of the person with disabilities. They are now overburdened. So they need to look after their family and also sometimes the domestic work. So this and the male members, they are also frustrated with their income. So this also increase the domestic violence also. So this is the problem the person with disabilities face in the community. So now I'm going to share the initiatives what my organization and we are taking to respond in COVID-19. So CTT, we are undertaking a number of activities to respond to COVID-19. So we first awareness. So we conducted the awareness with the different target group, person with disabilities, others marginalized group from the community. And we conducted this awareness through leaflet, miking, and other sources. And through this awareness, we reach around 2,000 people along with the person with disabilities. We disseminated the information about the protective measurement and prevention of COVID-19. And there is also a big role, our self-help group member. In my working area, we have formation around 118 self-help group in my project location. Only in my project location, already I told that I am working in 11 districts of the Bangladesh. There are 118 self-help group of the different type of the person with disability. So in the awareness message, they play a very important role. So they regular communicating with the other person with disabilities, with in the community, their family members and other marginalized people also through the mobile phone. And they're communicating and they're listening them, and they heard they arise some problem, they try to communicate to solve this problem. And they are also with the link, try to link us with the local government who are not receiving the service. So they are try to connect with to provide the support. So there is a for the awareness, not only awareness, other initiative in our whole intervention. There is a big role play that self-help groups and the disabled people's organizations. So this is one major activities, the awareness sensitization. And another activities, we provide some food package and also some hygiene, food and hygiene package for the person with disabilities. And we avail support around 2,000 people. It is not only person with disability, because CDD always we are thinking the inclusive, truly inclusive program. So we there are other marginalized that like the third genders, so others Dalit and others people. So we are also cover them, and we provided around 50,000, 2,000 food package and hygiene package. So we distributed among them. And there is also very important need to mention. So this program, we are not, CDD not itself implementing. We are collaboratively with the local government, our partner organizations and self-help groups, disabled people organization. We all together are implementing this work. And like local government have some, they have also provisions of some support. So our self-help group member, they are identify the person with disabilities and other marginalized from the community. They prepared the list and they submitted the list to the local government. And so through this process, who actually need the support through this process, this support goes with them. So this is also with the collaboration. We also work, we provide the support. And another initiatives we have taken, this is the hygiene promotion activities. So we provided spray machine and water spray nozzle, and also the chemical to prepare the disinfection. And this we mainly provided support in the local government. For we support local government, and local government use for the disinfection in the community, use this. So this is an initiative. And also we have with the health in the local level health department, we have collaboratively we also work to install some wash corner in the community. And we also provide one water tank chemical to prepare the disinfection the liquids. So this is our the activities we are taking. And another big initiatives, the advocacy, what CTD are doing. We are doing the advocacy with different concerned ministry, like concerned ministry departments and organizations. And our advocacy mainly focus the inclusion of the person with disabilities into response in the COVID-19. So as a result of this advocacy, so the disaster ministry, they circulate a circular. They already issued a circular where specifically mentioned the inclusion of the person with disabilities in COVID-19 response. So this is also from the result of the advocacy. And another advocacy, we have the NDD trust to inclusion of the neurodevelopmental disability in the plan. So this advocacy, for this advocacy, the NDD trust also provided food package for the not only NDD, they also provided the food package for the other person with disabilities. So this is our advocacy initiative. So mainly we are working, this is our initiative. Still, we are also planning to respond to the COVID-19. Now we are developing the proposal and submitting the others mainly. And now we are focusing for the post-COVID because you know this is badly impacted in the economic condition. And for the person with disabilities, some person with disabilities raise their voice, they are developed as a leader. But this situation again, they are now in remain them that is empowered. So if we want to empower them, so we need to their economic empowerment. So we are planning how we again involve them in the economic in the economic situation, we improve their economic situation. So we are planning in this, and also we are planning their mental health. We all know this is badly impacted in the mental health, not only person with disabilities, others also impacted the mental health problem. So we are also planning, and we recently developed a program. So for the mental health support, we already communicate with the government, in the National Institute of the Mental Health of Bangladesh is the government who are focusing on the providing the mental health support. So we plan to they have the hotline. So we try to link with them from the community and our self-help groups. Besides, also planning to develop some pair groups from the self-help group members. We provided some training, some sort of trainings, some basic training on the mental health issue online, and they can support in the community who are having the mental health problem. So this is the program now we are planning to introduce the next. So that's all from me. If you have any question or anything more, then I can include.
You have done such a huge job Thank you very much, Keya. What I get it from you is you reflect not just people with disabilities, but also people who involve with people with disabilities. For example, women in the family, mother in the family that might affected from violence, from stress because of this situation. And I have to say that people with disability have double impact from COVID-19. And I appreciate to hear that your organization, CDD, is a coordinator and advocate. You can advocate central government, local government, and can reach out people on the ground as well. And I'm interested to hear more later about self-help group, which is self-help group, which is very interesting. Maybe we can discuss it later. But can I move on to Thailand? Let's go to the next speaker, Mrs. Wichitra Chusakul. She used to work at NET Foundation, but now she is a freelancer. And today she comes on behalf of the Provincial Health Assembly of Surin Province, Thailand. Can I give you the background of a Provincial Health Assembly? Almost every province in Thailand has a Provincial Health Assembly. It is a neutral platform where the government agency, academia, and civil society meet and discuss on issues of the province and come up with the resolutions. And afterward, these people will put the resolution into action. Okay, may I invite Mrs. Wichitra to take the floor, please?
Okay. Morning, everyone. You can hear me? Yeah? Yeah. Okay. I talk with community self-reliance. Yes. Approach to fight against COVID-19 because self-reliance is an approach that NGOs and civil society have applied for development for a long time. When COVID-19 has emerged, we have to look back how we live. In the past, we had destroyed our motherland until the earth could not be recovered. So, review our life, create food security, rehabilitate natural resources, live our life with sufficient economy. All these are an important immunity. This is supposed to be a new normal. I think that that we can protect ourselves and protect each other. We will live together with peace and happiness. Help each other, take care of another one. Yeah. For role of Citizen Council of Province of Surin. In Surin Province, we have many NGO and CSO in Surin. I represent Provincial Health Assembly on this NGO and CSO under an umbrella of Civil Council. Yeah. During COVID-19, we have done, I think civil society have done many things. We have funded some amount of money to the Provincial Pandemic Control Center. Maybe it's small money, but I think this is important for everyone to work with the people. This is it means it's some powerful for them to. This funding is aimed to give moral support to health workers and volunteers. And additionally, we have provided masks, alcohol, face shield to hospital and community. All organizations have helped each other. I think like never before. If we regarding collaboration with the government, we have long been with the government in Surin. During COVID-19, the governors of Surin province has had a health model maybe you show this is the model of good health in Surin. Maybe the other province have this model too. Healthcare, economics, problem solving, adaptation, law enforcement, technology, and help and support. This is the model of Surin. The governor worked with the civil society to do this model. The governor invite civil society to participate a planning process for prevention and control COVID-19. The civil council proposed 3 principles and to the governor. The first one, we share them that conduct a survey and make a database of affected people from COVID-19, because sometimes we don't know who had affected from COVID-19. So if the data is okay, I think this is important for health together. And the second one is build an immunity of a community by strengthening food security and rehabilitating natural resource and environment, because I think this is important for everyone. Food and natural resource management, I think this is very important for serve our life. So the third one is develop measure for a new normal together with civil society. So you see, some community now they have a measure together against COVID-19. Example, some communities say that some of them have a rules or measure that every family should grow vegetables. Every family, yeah, because you must have a food. So this is easy for them to do. So this is the first measure in the community. In the community, some communities say that, and some communities said that not only grow vegetables, but you should protect natural resource management too. And it's about waste management too. So everything in the community, the people in community join together and have a measure to do, not only for COVID-19, but for to stay in the world, to join together and help together, and to take care the elderly too, to take care the children, the elder in the village. So I think COVID-19 have many lessons learned for us to join together with the government, because I think COVID-19 not only the new issue for us, but this is a new normal for us to work with together. And I think this is the lesson learned will forward to in the future too. So maybe the first I will sharing on this. Okay, yeah.
Thank you, Mrs. Wichitra. She gave an example of her province, which is what interests me is the governor invites civil society to work together on how to cope with COVID-19 in this province. And on the side of civil society, they have a civil council, which is the umbrella of many NGOs and CSOs there. So make the civil society in this province more powerful to talk, to advocate, and negotiate with the governor, which is interesting. And she mentioned 3 things that the civil council has discussed with the governor, which is database management is very important. The second one is how to make the community immunized, immunity of the community, which is she mentioned about food security and environment management. The last one is the measures to cope COVID-19 should be developed by the community together with local authorities, so that these measures will fit to their community. She mentioned about organic gardening, waste management, or how to help the elderly in the community. So this is her point. By the way, if the audiences have any question, you can text into our chat box, and we will collect it and ask the speakers at the end. So let's move to the last speaker from Myanmar, Dr. Situa, Executive Director from the Community Partnership Initiative Cpi from Myanmar. What has your organizations been doing during COVID-19? But what I am aware that you and your team are very busy. Every time that I contact you, you are pretty busy. So can you give us the pictures of COVID-19 in Myanmar? Thank you.
Sure, Nanoot. Nanoot and NHCO colleagues, first of all, thanks for having me in this webinar. And to the participants of the webinar today, thank you so much for joining us in the midst of this profoundly critical moment. I'm Dr. Situa, and Executive Director of Community Partners International. CPI is a US-based 501c3 organization with field offices in Myanmar, Thailand, and Bangladesh. In today's session, as Nanoot articulated, I would like to focus CPI activities in Myanmar only in response to COVID-19. In Myanmar, as one of the active civil societies, CPI works with the different types of the partners, including Ministry of Health and Sports, and also the Ministry of Social Welfare. Our local partners are actually ranging from small community-based organizations up to the national NGOs. We support them in terms of financial and technical assistance to implement health, community development, emergency response, and the research activities in remote, underserved, and the ethnic areas of Myanmar. This is the conventional approach that we have been using for several decades. Because of the time limitation here, I will highlight on our work in ethnic conflict affected areas only in this session. So before jumping to the response activities in the ethnic areas of Myanmar by CPI, I would like to give a brief contextual background for those who are not in accordance with Myanmar politics. So as most of you all know, like Myanmar is one of the most ethnically diverse countries in the Southeast Asia. It is also infamous about the longest internal conflict on the world in modern time. Since after its independence from British colony in 1948, ethnic armed forces in Myanmar began to break out in the country's periphery and called for increased autonomy. Even currently, in the current situation, the armed conflict between the Myanmar military and ethnic armed organizations are still happening, especially in Rakhine, Kachin, Sham, Chin, and Keya states. For several decades, people in these ethnic conflicts affected area were in dire need of basic health services. And you can imagine about what is going to happen in this COVID-19 crisis, why they have been suffering this sort of humanitarian needs and assistance, even in the ordinary situation. So in response to the chronic catastrophic situation due to conflicts since in the beginning, ethnic groups started to initiate their own community-based primary healthcare services and the structure. Ethnic and community-based organizations are the basically only service providers for the populations in these conflict-affected areas. they normally provide primary health care, war injury management, essential maternal and child health, malaria and health education, and other water and sanitation programs. So CPI has been working with these organizations and furnished them with the necessary technical and financial assistance for several decades. So in COVID-19 crisis, so these health facilities and health workers from the ethnic organizations are actually in forefront for the populations in conflict-affected areas in Myanmar. So our supports can be generally categorized into 4 main categories. So especially coordination across the different stakeholders for the non-state actor areas, how they are going to communicate and collaborate with the other developing agencies and also with the Myanmar government. And also we provide technical support. We also do the resource mobilization, and we support the medicines and supplies as well. So to elaborate a little bit about these responses, so starting from February 2020, CPI has been sharing the information about COVID-19 to our ethnic partners organizations, organized a series of consultation meetings with them. And through these consultation meetings, we keep them informed about what is unfolding and help them prepare for their contingency plans and identify the requirements and the needs. One of our supports is to provide the essential medicines and supplies based on our consultation with them. So because of the limited access to water in some clinics in the ethnic areas, we decided to include alcohol-based hand sanitizers in our supplies package. However, starting from February, one interesting thing is, like in the other regional countries, because of the high demand, hand sanitizer prices were skyrocketing and exceedingly difficult to buy in the market. So CPI staff members came up with some innovative idea, and we decided to produce 70% alcohol hand sanitizer in accordance with the WHO guidelines. We produce around 3,000 liters of the hand sanitizer and distributed to the community-based clinic for those in the conflict-affected areas in Myanmar. So in addition, to cope with the uncertain nature of the situation, so we were concerned that the disruption of the essential supplies for the ethnic clinics, because they are basically the sole providers for the health services in these areas. What if there is a disruption of the transportations and logistic change? So we were concerned about their stock. We decided to stock up with a package of essential medicines and supplies, which includes the masks, gloves, non-contact thermometers for the clinics and the health workers. With the tireless effort of our staff members, CPI could manage to distribute the essential medicines and supplies package to 180 ethnic clinics within 2 weeks. So basically just before the Myanmar New Year holiday in mid-April. So as we all know, the other support that we are doing, as we all know, for battling against the COVID-19, risk communication and community engagement, it plays a critical role in battling against COVID-19. And CPI developed various types of COVID-19 health information materials in accordance with the guidelines from the Ministry of Health and Sport for the community, and distributed to our ethnic and community-based organizations in the ethnic languages as well. The other support on top of that is that our support to the ethnic groups is the technical assistance on COVID-19. Our technical assistance encompasses the online remote training on prevention, signs and symptoms of the diseases, the referral services, and planning and designing their response activities and their respective coverage areas for the ethnic health workers. In summary, our support basically enable more than 20 ethnic health organizations carry out the risk communication and community engagement activities in their conflict and the ethnic areas, and they can do the screening at the point of entries and borders, because there are several illegal migrations along the ethnic borders area as well. And the community quarantine activity and the continuation of the essential health services in conflict-affected areas. So these are the summaries of the CPI activities in Myanmar as the initial responses for the ethnic communities. Thank you.
Thank you. Thank you very much, Dr. Situra. I can imagine how difficult to reach the ethnic people during COVID-19 lockdown. And I have heard that you work almost side by side with the Ministry of Health and Tourism to help ethnic groups and also support health workers. And I found it quite, your point is interesting that because ethnic groups has different languages and it's difficult to communicate with them. By the way, I just got an information. I just got questions from one of the audience asking about how to reach out unreached people, for example, prisons or foreign migrant workers particularly in Thailand, who have different language with us. Can I ask two Thai speakers if you can share your view, how Thailand ensure rights to information is realized for people in difficult? Simply the question is that Thailand also have the same problem with Myanmar in terms of the language, language barrier to other group of people in order to cope with COVID-19. Myanmar have ethnic groups, but we also have, let's say, foreign migrant workers or people in prisons that we cannot talk with them. I would like to ask Dr. Niran, how can we solve this problem? How can we ensure that these people have their rights to reach the information?
Yeah. Can you hear me? I think that about what we call this group is the vulnerable individuals, such as migrant worker, or even in ethnic group, or even in the migration, refugee, or the stateless people. That people that in Thailand we have the many areas that composed of migrant worker and even the labor group from abroad, even in Myanmar or in Laos or Vietnam. So the principle of to manage and to bring them to have in the good health, we must think health as a right, and we must think that the freedom of the individual to take care of themselves from hunger and misery, even in the life, being life is very important too. So all of these people that's unemployed by the business part, we know that in Thailand we have many economic zones that employ these people, and these people come to Thailand by the economic problem in their own homeland. So when disturbed by the COVID-19, all of this business stop and make them disturb. That I have the number of the unemployed and about the lower class in Thailand that disturbed by the COVID-19 approximately is about 13 or 14 million people. About most of them is the decrease in the income, about 60% as the usual. So we must depending on two factors. One is about the political view for the government. We must take care of them because they have the many problems to go back to their country. So we must try to support them in their living life in Thailand and try to make them continue their health in the local area. And this is most important. The government part or the political part must have the natural public policy to deal with the business, to take care and beware of some disturb them in the community. The second is about how to make them have the benefit by this situation. I think that in Thailand we have the third time to have the decrease the policy. So we have to have the policy to make them working as their own in the some part of the area. So I think that the freedom of the working as them usual must try to bring them come back to their usual life. So this is the most important, how to make the public policy in the third phase of the COVID-19. Until now, we have the government that set the policy to, we call the semi lockdown, to make them have their usual life. So we try to make the public policy by their own and make the government and how to centralize to the bureaucratic system in the local area. The department or ministry of the many area that take care of them and make them to have their living life for in Thailand. And the last one is try to make them can bring back to their homeland. In the northeastern part, Ubon Ratchathani near Laos, Cambodia and Vietnam, many people that come from the southern part or in the Southern Asian go to Ubon Ratchathani to go abroad to Laos. Last 1 or 2 months ago or 2 weeks ago, we have many people from Laos that went to Laos and in Champasak or even in the Vientiane to continue their life in their homeland. That and bring that if we can send them to their country, is the most that they wanted for these people.
Thank you for your answer. I will not summarize because I have quite a lot of questions come up from audiences. So this is the questions for all. If any speaker would like to answer this one, how you have seen universal health coverage is useful in the fight against COVID-19, especially some people are not covered by health insurance.
You asked me?
I ask the question again. How have you seen universal health coverage is useful in to cope with COVID-19? Does universal health coverage is help during COVID-19?
I think this is a universal health care that is can manage this situation. But some labor group, they have the insurance that can manage by themselves. But in the labor group or in the migrant worker, they do not the people from Thailand. They did not the Thai nationalism. So that is urgent to take care of these people in the every country that this group of the people try to living by themselves. So I think that this is the government must try to the program to talk the people in the ASEAN how to manage these people and how to bring these people go to their homeland to bring them to their community. I think just only universal health care cannot manage overall, but the public policy for manage the migrant worker or even in the labor group is very important in this situation.
Thank you. Universal health coverage is useful, but perhaps not enough, what he mentioned. In each group of population may come up with their own policy in order to discuss with stakeholders or government. But this question is not to Thailand. If Dr. Situa or Keya have any view on this question, please feel free to answer.
Thank you, Nanoot. I think I would like to provide a few inputs to the comment that the doctor just responded. I think first of all, like the Myanmar, we have been trying very hard to move the Myanmar health system towards the universal health coverage, like the other developing countries in the South Asia region, and the Thailand has been one of our ideal sort of like health system reforms, and one of the countries that we have to emulate. So when we talk about the universal health coverage, it's not just about the service coverage. I think we also talk about the system's readiness. In the system readiness, one of the universal health coverage goal is not just for the provision of services, but also the responsiveness. So responsiveness to the needs of the community, because the universal health coverage, whatever you have, like how many schemes that you have, how many insurance plans you have, these will not be able to cover this kind of like COVID-19 unprecedented situation. So we won't be able to do whatever systems we have. We will not be able to explicitly mention about these kind of the new sort of emergent problem could be covered. But I think the system itself, after achieving the universal health coverage goal, the important point is the readiness, system readiness to the response to the unpredictable situation. It's the key for the universal health coverage goal. So that's why in my opinion, I think when it comes to the universal health coverage goal and COVID-19, we should not be look only at the service coverage, but also we have to pay attention towards the system readiness and the how responsive the system that we have could provide quickly can come up with the plan to cover this kind of new emerging health problems. I think that is the essence. And so that's why I think that, whenever we are talking about universal health coverage, there will be no enough sort of like thinking and the plan having a system readiness and the how to respond to this kind of pandemic in future for moving towards the universal health coverage.
Thank you very much. Definitely, because this pandemic is unprecedented. Universal health coverage, only that is not enough, that he highlighted it, because systems readiness is also important, as well as kind of emergency plan, resilience, and everything that have to come in one to solve this problem. Thank you very much. And Keya and Wichitra, would you like to share your view on this question? Please, Mrs. Wichitra.
It's not for your question, but I think I share my opinion about the goal step. I think we are going to have a new world and a new normal. I think the challenge is that how we live our life without exploitation of one another. Liberalism should be reviewed. I think liberalism should be reviewed. Is it good if we live based on sufficiencies and respect one another? So I think COVID-19 proved that we should win this game. Nah? We have to join hands between the government and civil society. Both parties have its strength that can complete each other. I hope post-COVID-19, the collaboration still maintain and to make it stronger. So go together. Yeah.
You, Mrs. Wichitra, good point. She's mentioned about collaboration between government agency and civil society. That as your presentation or speaker's presentation, that quite you come to the same direction, that you have a good collaboration with both sides. That's why these countries can cope with COVID-19 quite well. I have a question that, do you think this collaboration can maintain after COVID-19?
Sure. Sure. I think we should work together with the government, with the businessman, or everyone, because we think everyone fight against COVID-19. Okay.
And how about other speakers? What do you think?
Yes, Nanoot, I am also the same opinion, because I also have some learning while to respond the COVID-19. First is very effective in the collaboration and coordination among the all stakeholders. So if we collaboratively work, so we can reach more people, we can cover more people. So this is very important in the collaboration and coordinate. And also another important is the effective communication, which we have also learned through this process. Effective communication means we know in Bangladesh, most of the people, especially the person with disabilities, are in the rural area. So they sometimes they have no proper information, they don't know how to do, and they don't understand about the management of the COVID-19. So there is very effective work. Our self-help group of the person with disabilities, they try to reach these marginalized people, the person with disabilities, and they through the mobile they communicated them, they listening them. So this also support two way. Once they understand, they have the message about the awareness information, they receive the awareness information, as well as they also this communication sometimes also reduce their stress when others listening them their problems. So this also reduce some sort of stress. So this is really work very well. So my observations, there is a collaboration must, any type of crisis, collaboration and coordination, and the effective communication.
Dr. Niran, I see you want to say something.
Yeah, may I share some opinion, but slightly different. I realize that COVID-19 is what we call a global crisis, but until now I cannot see about the global response and the global good collaboration, because if we separate about each country that face about the COVID-19, we can bring them about two groups or three groups. One group, they have many problems about his own country politics, and they cannot make the bureaucratic system to manage about the COVID-19. Even there's a good country for biggest country or powerful country, but they fail about the manage of the COVID-19 and bring about the crisis in their own country. So this is that's not like about the World War II. Post World War II, we have the many global response that the cooperation until we have the human rights organization or the try to make the peaceful process for harmful in the world. But until now, COVID-19, we have the little country in the Southeast Asia, Myanmar, Laos, Thailand, even in the little country that can make and manage COVID-19, I think is very effective. But I cannot say about the cooperation in each region. So at the conclusion that number one, each country must make them good by themselves for the people. I think the most powerful to bring them the group process for the COVID-19. We try to make the people participation in the community, because the community, I believe that the civil society organization or even NGO or the people in the community realize that that is the most dangerous for themselves until now or the next 1 or 2 years. So this situation bring them can manage by themselves. So the process of the people participation and dealing with the community engagement, I think very important. The second, we have the many countries such as in Thailand, we have the public health bureaucratic system. So the medical staff or the public health officer, they work hard even in the volunteer in the community. We call OSMO. The volunteer in the community public health, they work hard to combat with the COVID-19. So my conclusion that each country, not big, but little country, can make the good process. And this is a good example that the global response for the COVID-19, we must collaboration each other. Not think that this is the big country, this is the most powerful. They may the bad management for the COVID-19. So I think that this is the most problem now, how we manage by each country as the good example for the new normal for each country. And then learning by doing together. And we have the conclusion, because COVID-19 affect every part, even in economic, social, and the politics, and every country, about 200 countries in the world.
He said that we quite do well on collaboration within the country, but at the global level is less collaboration. But in fact, as we have heard from Bangladesh, Myanmar, and Thailand, and other countries, small countries like us, we have done quite well to cope with COVID-19. While other countries, that powerful countries, cannot manage well. Actually, we should learn from each other and share our experience and might collaborate among us, among small countries like us. Can I have another question? As we just said that we have done well to cope with COVID-19. Which factors have helped you as NGO or civil society have done a good job of reducing the impact of COVID-19? Who would like to answer first?
Maybe I can. Thanks for this question, Nanoot. I think it is particularly important for all of us as civil society, regardless of wherever you are based, in whatever thematic areas you're working. So from CPI experience in COVID-19 responses, so these are not the activities and the plan that we have in our annual, work plan as we do in the traditional way of conducting the activities by the civil societies in the many development arenas. So I think the among several factors, I think the organization culture comes first. The CPI's ethos, our ethos is centered around agility and the responsiveness to the capricious situation, so to the unpredictable situations. That's why we didn't stay apathetic or indifferent. as early as February, we started to be prepared what we could support to our partners if the situation became insidious or getting worse in Myanmar. I think secondly, I have to say that the CPI team members deserve kudos for the effective and the timely response. So their teamwork, ingenuity, and the persistence contributed to the successful implementation of the initial responses. So our staff members work round the clock and very cohesively to tackle this COVID-19, the dangers, and also they came up with the ideas and solutions when we encountered with the problems. For instance, in the our own production of hand sanitizer for the distribution to the clinics in the ethnic areas. There were daunting challenges in different perspectives during the implementation, but our team members never gave up. It's really a humbling experience to see their enthusiasm and the dedication towards the fighting against this COVID-19 problem. Thirdly, I would say trust and cooperation from our partners. So because, reaching out to this, the ethnic and the conflict areas, we cannot really do alone, because even if you have tremendous and the endless resources, without the cooperations and working with these local partners, you cannot reach to these unreached populations. So when it comes to the crisis, the local ethnic groups are the key people. They can navigate the ways for the effective responses, and I really appreciate about their trust and cooperation with us to make the responses happen. So these cooperations and the trust came from the long-term partnerships between CPI and the ethnic partners. So without them, all of our work will be useless. Last but not least is the support from the donors and the guidance from the government, such as from Ministry of Health and Sport and the Ministry of Social Welfare. We won't be able to implement these kind of activities without the support from the different donors supporting to CPI as a civil society organization, and the stewardship and the guidance from the government ministry. So among these, the numerous factors that can be influenced into the implementation of our work, I think these are the key factors that I would like to share here. Thank you.
Thank you. Yes, definitely trust and collaboration with partners is very important. And you gain trust because your organization has capacity and effectiveness. That's why your partner trusts you. And also the support from donors and government, because the capacity of the organizations that make sure that ensure the government and donors to support you. That's very appreciative. I would like to hear from other countries, either from Thailand or Bangladesh. Which factors have helped you to do such a great job reducing the impact of COVID-19?
Okay, Nanoot. I also want to add something. Almost same thing what Myanmar friends already shared is almost the same factors also is in our work. So first, there is the multi-sectoral collaboration in all level, local to and national level. So when we plan, we involve the whole stakeholder, like in the local government, civil society organization, the organization of persons with disabilities, and others development sector. So this is a very good initiative for to plan for inclusive way. So this is the one factor, enabling factors for the of the response. And another I would like to mention, there is a collaboratively work with the different ministry of the government. So there is in the community local level to national level, there is a different sector of the government. There's some are working in the social service department, some are some response plan from the disaster ministry, and some on the others ministries. So if collaboratively they plan. So this is also very good to reach more people and cover the more. So this is also very good factors. And another already I mentioned, there is a big strength for the for enabling factors in our experience and our working area is the self-help group of the person with disabilities, because they also work as a resource in the community, as a pressure group for the local government for the inclusion of the person with disabilities and other marginalized people for the community as a priority basis. So this is also very effectively work for the inclusion for all and thinking the inclusive way. So this is for my experience.
That's good, because you raised the good point about the collaboration, that should be collaboration at all levels, at all sectors,
definitely.
and
Yes.
at all stakeholders. Good point to reiterate that. And you mentioned about self-help group of the people with disability. This is similar to village health volunteers of Thailand. They are backbone of the health system that can reach the outreach. That's good point. And they help doctors and nurses to sensitize this issue to community. May I hear it, this question, the answer from Thailand, please? Wichitra, please.
I think COVID-19 is the situation affect everyone. So we have to make everyone to aware that we have to help each other. It's not one situation for businessmen. Yeah. So we should to help together, hand in hand together. Therefore, you can see the unity of all sectors to fight against this pandemic. So I think we join together, help together. It's not situation only for business, nah? Thank you.
Thank you. The factor that she mentioned is generosity of, I think it's all Asian culture though, generosity, empathy. That's why it can help solving this problem.
May I add some idea? Nanoot? May I add some idea? Yeah. I want to add some idea as Wichitra said. In my opinion, I think that the social measurement is important than the government or the political Emergency Act. In Thailand, we have the Emergency Act and emergency to order the people to take care about the COVID-19. But this is the strong drug that make people disturbed by. We cannot use the Emergency Act for a long time because they disturb many people, especially the people in the poor people or in the vulnerable individual. But the social measurement is the lucky for Thailand that we have the process by the National Health Organization that settle about the public health area and public health policy about 20 years ago. So we have the organization of the health system in the community, such as the district hospital, until to the community. We have the community volunteer more than 1 million. Each individual of the district community, they set up to take care about 10 or 20 people about COVID-19. So when have the people from abroad or the people from Bangkok, from Phuket, come to Ratchathani, each one of the community, they try to take care about 10 or 20 people that come to their village and take care that they have to guarantee themselves, they have the social distancing or suggest them to make the better to prevention and the promotion they have to not disturbed by the COVID-19 and spreading the COVID-19 to each other. So I think that the social measurement, and we have the strong people participation, how to come back to set about the policy in the community and make the community engagement. They have the benefits each other. They have learning in each other that make the prolong and sustain way to combat with the COVID-19, because you know that COVID-19 in Thailand or in the world for more than 1 or 2 years. So community is very important to combat the COVID-19, and social management is very important, much more than the politics, the emergency act or any way that order the people.
Right. Thank you. He mentioned that the factors in Thailand is social measures, meaning that even though the government has measures, but maybe it's not enough, we should have social measures developed by people for themselves. That's why we should get people engaged in controlling COVID-19 as well. And he called it as this is called participatory public policy. That the policies that developed by people, by the community. We quite run out of time. I have to say that we have a rich discussions on the role of civil society in response to COVID-19. And I believe that the audiences will learn a lot from us as well. Before the ending the webinar, I would like to invite Dr. Weerasak Puttharsi, Deputy Secretary-General of National Health Commission Office, to give a closing remark. The floor is yours.
Thank you. First of all, I would like to thank all speakers for sharing your experience and wisdom, which is for me is interesting and very open my perspectives. For me, I have learned a lot. I would like to mention about at least 2 points that I learned from in the term of the civil society that you share us. First one is now a clearer definition of the civil societies. Some people consider that the civil society is the presence of the people, mean their home and their community. Some people believe that civil society is a set, including the people in different communities in the society, with the impact of the society in some way. That Surin Provincial Health Assembly might be fit into these definitions. Some people consider that civil society as a public institution or organizations that include the number of individual or group. They have a corporate, political, social, and cultural aspect to the society. In this webinar, we see the Bangladesh CDD and Myanmar Cpi is already elaborate, presented or to fit to these definitions. Secondly, I found that how important of the civil societies. From speakers, we got the eyewitness of a clearly role of the civil society, including the civil society act as a watchdog in the community, such as the surveillance of the disease, identify the people, the persons who might be get this target of the COVID-19, who just travel from outside into the community as well. Dr. Niran has presented the picture for us, how the group of the people in the local community can do themselves against the COVID-19 challenges. The civil society is act as the advocator or campaigners to raise awareness of the COVID-19. give and echo the voice of the marginalized group, of the disability group in Bangladesh, of the some ethnic group in Myanmar who got affected from the COVID-19 in both health and daily living. In Thailand, also advocated for the initiative or innovative of the physical and social distancing intervention based on the different local contexts. Civil society maybe acts as a service provider, especially to provide basic community health services, support the disease containment, support the people who need to quarantine themselves to comply with the state regulation of the COVID-19 controls. The civil society also to be the builder of the active citizenship. In this case, civil society motivate the civic engagement, especially to the local levels, in supporting the national policy as well. For instance, in Thailand, the communities was encouraged to discuss and end up with the community agreement to do something together using the local health charter or health constitution approach in Thailand. These are examples. I would conclude my observation that the COVID-19 situations makes the role of the civil society more visible. This time, the civil society occupied the important positions in development of dialogue to bring the community together to collection the action, mobilize the social demands, voice concerns, and wisdom, which is synergized working with the local and national government or the formal sector as well. I found that our sharing experience from you all in this webinar in respect in different social and cultural context is very useful. Hopefully, we can move not only the sharing experience, but how to move to the more collaboration and synergize working together in the future. However, it seems that some further challenges is waiting for us from the crisis. What is our role as a civil society and approach after the lockdown ends? It's not the disease and medical interventions, but it's moved to the focus how to cope with the economics, how to cope with the lose the job, income loss, and of course the social new normal aspect as well, especially for the people and community who must suffer from the COVID-19 intervention impact. That is my observation from you. I really appreciate your sharing. Thank you. Over to you, Nanoot.
Thank you very much, Dr. Weerasak, and all speakers and audiences. This is our first time to organize the webinar, and we get lots of attention from all of you that is touch our heart. And if we organize the next webinar, we will inform you again. And we will send you a summary of this discussion and to you by email, as well as an evaluation form. So please give us the feedback so that we can improve the webinar next time. And last but not least, we would like to have a group photo. Please turn on your camera if you have not done it yet, and then smile, and then we capture your picture. All right. Once again, I would like to thank all speakers. May I mention their names again? Dr. Niran from Thailand, Mrs. Wichitra from Thailand, Dr. Situa from Myanmar, and Keya from Bangladesh, and also Dr. Weerasak from Thailand. And I hope that we, as Dr. Weerasak mentioned that we can hopefully that we can collaborate in the future or organize the webinar on other topics or have some government representative to join us next time. Right now, we already have captured the photos of the participants and speakers, and we will send it to you later. I have to say goodbye to you, to everyone, and thank you very much for your participation. Bye.
Bye-bye. Thank you, Nanoot from Bangladesh. Thank you. Bye-bye.